Hello and welcome to our first Caregiver course, Building a Care Team. Today we're going to have some people here speaking about resources that would be beneficial to add to your care team. As a caretaker, it's really important to have support so that you're not having the burden of doing everything for yourself and another one. Support improves your mental and physical health, so it's great to have other people that can help you out. Our first speaker is going to be Nancy Hyatt from the Care Group, who's going to present about what her organization does and how that could benefit caregivers in the
county. Good evening, everyone. My name is Nancy Hyatt. I am a social worker in private practice here in Woodstock, Illinois. And my company is called the Care Group, care with a capital K and a lot of heart. We are healthcare advocates and care managers, and we help people navigate the healthcare system. So pretty much I talk in terms that I am within the healthcare arena. I'm not a doctor, I'm not a nurse, I am a social worker. And we work with caregivers because they're the ones that have the duty to help their loved ones, family members, whatever the situation may be, get through everything that has become very complicated, very frustrating. I've made some notes and passed out some papers, so I may be referring to these. Why do we need a care team for ourselves or for our loved ones? Very simply, because it is very complicated. It's very hard to figure out what to do because it changes daily. And you may think that healthcare systems speak to one another, communicate with one another, look into their computers, into their systems. That is not how it works. So you have to put together a team, because if you try to do it yourself, and I'm going to just use the example, a grown daughter who is taking care of her 80-year-old mother, who is a widow, and the daughter, will just say, is 53 years old, and she has her own family, she's married, she has children, and she has her 80-year-old mother. So she is what we would call the primary caregiver for her mom. At the center of the care team is the patient. I call them clients because I'm a social worker, I'm not a doctor or a nurse, but they generally are called in the healthcare arena the patient. So that person is there at the center, so that would be 80-year-old mom. And so now we have the 53-year-old daughter who is married. We'll say she has 3 children, she has her husband, she works, the husband works, and she is trying her best to help her mother. And we will just say that mom has recently been diagnosed with breast cancer. So mom is going to have surgery, and then mom is going to have radiation and chemotherapy. That's a lot going on for an 80-year-old woman who is independent. Mom has her own apartment. Mom still drives, but mom now is facing some very serious health problems. So daughter is going to be the one who is going to put together the care team with mom's input, because first off, who else is going to be in this circle should be the primary care physician. Some people don't use a physician, some use a physician's assistant, some people use a nurse practitioner. Whatever the situation may be, that medical person is going to be part of the care team. Because, and for this case, we'll talk about that's going to be a doctor, a primary care physician that mom has been going to for 15 years. That person is the integral part of the medical care part of the care team. So got the doctor, because your mom is also going to see the nurses and the other people when she goes to see the doctor. Besides the medical part there, we're also going to include other family members. Mom may have another daughter, may have sons, that grandchildren. She may have sisters, brothers, her own self. Whatever family members also become part of the care team. Mom may have been very active in her church. So mom has people from church that she's been friends with for years. Those are her friends. And she would then, that would be part of her care team. Now, I'm describing what the components of the team are, but then we're going to talk about how it all can start interacting to the patient and the caregiver's benefit, right? So let me take a look here at my notes. One that I really like is to make sure that mom has a good pharmacist. And, you know, mom may go right down here to Jewel Osco to pick up her prescriptions. She may go across the street at Walgreens to get them there. But wherever she goes, sometimes you need to not drive through. You need to go in. You need to learn who your pharmacist is, because one of the things that I always highly recommend to the caregiver and to the team is that a good checkup with a pharmacist is invaluable. You go, you have the patient's list of medications. Sometimes it may be 2, maybe 3. I have seen so many lists of 10, 15, and as they age, it's unbelievable for older seniors. You'll see a list with 20 medications. So besides talking to the primary care and saying, excuse me, doctor, and this would be coming from the caregiver, does my mom need to take all of this? Is there anything that we could do away with? But the pharmacist is who you would go to almost first before the primary care doctor or the PA or the NP. And to say, this seems like a lot. What's going on with all these different medications? And always having an updated list is very, very important. Mom may not be able to do that for herself. She may not want to do it for herself. That's something the caregiver should do. It's very easy. Just put together the list, what the dosage is, how many times a day, what time of days that the medicines are given, etc. Now, mom may already have what we call non-medical caregivers. They can come from a company such as Visiting Angels, First Light Home Care, Home Again. There are tons of caregiving companies, what we call non-medical. So these are people that can come into the home. They work with mom, companionship, a little bit of light housekeeping. They're not maids, a little bit of light housekeeping, a little bit of light meal preparation to help. So mom would have her meal while the caregiver was there. They can, like I said, companionship, play games. They can drive mom to the grocery, you know, help her shop, bring her back, whatever the needs may be. From a company, or sometimes they are self-employed, people will use people because they know one of the caregiver's relatives. Personally, I would just say I highly recommend companies for a specific reason. The company hires them, they vet them, they train them, they discipline them, and if need be, they terminate them. A self-employed caregiver, nothing wrong with that. But then whoever employs that person, caregiver or mom, becomes the employer in the eyes of the state of Illinois. So it's just something to consider, but that person is also an integral part of the care team, because they're probably going to be spending more time with the patient than others. And then I think lastly, I have sometimes, and I'm very attuned to this because I have found more and more people don't just look at what we call traditional medicine, doctors, nurses, surgeries, treatments. They also look at things that are more holistic, and that's what we call traditional medicine workers, acupuncture, massage, herbal medicines. So they also would become a part of the care team. So if you can see how full circle that becomes, because you've got a little bit, if they're strictly like regular medicine and they're going for the treatments, you know, the doctors and nurses provide, that's wonderful. But they may be on the other side and look more for the non-traditional and things like I just mentioned, the acupuncture and massage, etc. A lot more people nowadays combine the two. So if they do that, you're going to want one person from each of those groups. How does the daughter start this? You know what? She just starts talking to mom. She starts writing things down, because caregivers should also have a list of every doctor that mom goes to, because it's not unusual in this day and age that somebody at age 80, she may have her primary care or an internist. Some even still go to the family doctor, but she also, now she's going to have a cancer, she's going to have an oncologist because of the cancer. She's going to have a surgeon because she's going to have the surgery. We'll say that she's going to have a mastectomy. The specialization nowadays is out there all over the place. So it makes sense to always have a list of all the doctors, their addresses, their numbers, their fax numbers, who their head nurse is, because it makes life easier for the primary caregiver, who is the daughter. All right, I've got a list. I'm going to finish up with some tips, just because I think giving people tips is invaluable as well. I've been in my running my business for 8 years, and I've had so many cases that have been very difficult. And there's a myriad of reasons why cases are difficult. But it usually has to do with family, because family may disagree on the course of treatment for mom. They may not, families are just families, and that can happen. But what we want to do, and what the daughter wants to do, is to try to bring a calmness. And that's why she's getting the help to have this care team, to get everything kind of just, you know, calm down. Nobody wants to have arguments or family problems erupting when someone is sick and someone is going through things. It's much nicer to have things calm. That's why things for mom, the patient, like massages and a little acupuncture, it's nice. You know, I also forgot this, and I think this is really important. Mom might need a counselor, a psychotherapist, whatever you want to call them, a psychologist, somebody that mom can talk to by herself, that she can talk about what's going on with her health and with the cancer and with all the treatments, because it's not an easy road to go down for surgery and chemotherapy and radiation. So let's always remember that. And that's for the caregiver also to bring up, you know, mom, and sometimes as a social worker, I don't call them a psychotherapist. I ask people, would you like a counselor? Would you like somebody to talk with? Because you want the idea received well. And sometimes you just kind of soften things out. The caregiver daughter is like the manager for mom's health care at this point in time. Let's see. I'm going to give just a few tips here. What all of us can do, whether it's for your own family, for your husbands, your children, your wives, whomever. People need to make sure that they have health insurance, because I guarantee you, trying to navigate through our healthcare system is a nightmare if you do not have some kind of insurance. And you know, there is the the Affordable Care Act, which we all know passed back in 2010. Actually, everybody's supposed to have insurance. So if you, for your own families, if people don't have insurance, you can always go online, Affordable Care Act, find, because there's ways that it becomes affordable. For people 65 and older and people with disabilities, there's Medicare. So you want to make sure, look, we'll get back to the 80-year-old mom. The caregiving daughter, who is now more involved in her mom's life, needs to make sure, what does mom have? Does she have Medicare Part A and Part B, regular old Medicare? Has she switched over to a Medicare Advantage program? What exactly does she have? Does she have a supplement that goes along with the Medicare A and B? There's all kind of plans F, G, A, B. They all cost different amounts of money, but all of this pays, because nobody wants to, number one, have to go through this and then owe a ton of money. Because I guarantee you, the hospitals will charge, they will bill, and they expect their money. And to have to negotiate and go through all of that is a headache. Make sure from the get-go there is health care insurance and what the co-pays are going to be, etc. All right. All right. Now, what daughter caregiver needs to do is find out, did mom and or dad ever purchase a long-term care policy? This helps in case somewhere along the line, mom needs to be in a skilled nursing facility, or she just needs to be in assisted living, but she may need, as time goes on, memory care. Is there a long-term care policy that helps pay for these places? Because right now, Medicare does not pay for any of that. They don't pay for they don't pay for memory care. They don't pay for skilled nursing, long-term. They do not pay for assisted living. What in the state of Illinois will do that if people don't have the private funds is Medicaid. And some people just call it plain old public aid. But people need to understand that there is a difference, because I cannot tell you the adult children who say, well, Medicare will pay for that. No, they do not. They pay for the hospitalization and they pay for Part B. And then there's also the Part D, which you have to pay separately. And that's for your prescription drugs. And they don't pay 100% of that. They never have. So families, meaning the caregiving daughter, is the one that's like the gatekeeper. And she needs to keep a pulse on all of this, because that is all could eat into mom's money for retirement funds. Okay. So for an adult over 65, or if they're younger and they're on disabilities, Part A Medicare, Part B Medicare, and then a drug plan, Part D Medicare. The long-term care policy that we just talked about, those are usually expensive, but when mom and or dad may have purchased it, it might have not been so terribly expensive. And what I have told some of my clients is the following. If they have that policy, and they no longer have the funds to pay the monthly premium, pay it for them. It's invaluable when they need it. All right. So with that, just a few parting things to think about. You have your care team. The daughter's going to be the manager of the care team, the gatekeeper. But what having that group will do will be to give the primary caregiver a break. She will have time to work. She will have time to raise her kids. She will have time with her husband, because you set up things so that mom can get help from this care team. I hope it makes sense why I am a huge proponent of a care team. I can't imagine any family getting through something, especially with their older seniors. Or you know what, it's not just that. We could talk about a 40-year-old husband, you know, that was just, that had an accident, and he's had multiple surgeries and he can't work, and it doesn't matter. It can happen. People that have a child who have been sick, they need a care team, because mom and dad can't do it all. There's just no way. And work and raise the other kids, it's impossible. So what I will tell you a little bit about me is that there are some people who hire me because they simply, there is no way they can do it. So I'm hired on as the care manager, and I am able to put together the care team. I am able to make sure that everything runs smoothly, because this is what I do. I do this just like everyone has their job. I have my job, and I know the healthcare system. All of my colleagues that do what I do, we've all learned the healthcare system. We're all, we're attuned to all of the changes that are made, sometimes daily. We know how to navigate, who to call, how to get it done. And when things are done and everybody's, it's not always like a mode of urgency. Everybody can just calm down. Mom's getting through her things. Everything is going along all right. All right. And then I also have to say that I've had several cases where I was hired by relatives because the older senior did not have children, maybe didn't marry, has no relative, no close relatives. So there are people like me out here. There's more and more of us, because everything within the healthcare arena has become, like I've said a gazillion times, very convoluted, very challenging, and people lose patience. And sometimes they just give up. Does anyone here tonight have any questions? A good care team has a primary caregiver who is the manager and who will put everything together to help the patient. Thank you very much. It was nice being here.
Thank you, Nancy, for speaking about the care group. And now we have Diane Adams from Senior Services to speak about T-Care and how that can be a part of your team.
I've been with Senior Services for about 10 years, and for the last 2 years, I've been their caregiver specialist through a program that started with the local area on aging. So basically the program T-Care stands for Tailored Care Assessment and Referral Caregiver Program. And basically it is a program for caregivers. It's a program to support the caregiver who's providing the care to another person. And so once I receive a referral, perhaps it's from a coworker, perhaps it's from an agency, a doctor's office, perhaps it's you yourself that's referring yourself. I make an appointment to do an assessment, and it is free of charge. And through that assessment, which takes about 40 minutes, we talk about what's going on with you as a caregiver and how, what kind of things you're doing for the care recipient, what kind of things you're doing for yourself, a little bit about your feelings and how things are going being a caregiver. It is a evidence-based assessment, which through that assessment, it actually determines which areas a caregiver needs the most support in. And then after the assessment, we meet again for about half an hour and develop a care plan just for you, the caregiver. That plan is based on what you need and what the assessment says you need, but it's always driven by what you want and what you feel would be most beneficial to you. It's my job to do the legwork of finding the resources you need. It's even can be my job to connect you with the resources you need and to follow up with you to determine, if it's working, if it's not working for you. And then about every 3 months, there's a definite follow-up that at any time I am available for any kind of questions, supports, referrals at any time ever. So as long as I'm there. No, this is a program that really started at Senior Services with no funding whatsoever. So I've been doing this on top of my other jobs. But we're going to be getting some funding soon. So it's actually going to be a real job, but it's always free to the caregiver. It costs nothing. If you're interested in this program, you can contact me at Senior Services. My phone number is 815-344-3555. There's also a confidential caregiver screening tool online if you're into that kind of thing. And that is at ssamchenry.tailoredcare.com.
Thank you, Diane, for speaking about T-Care. And now we have Olivia Nystrom from here at Independence Health and Therapy to talk about our community support program.
Thank you for having me. As Annie had stated, I am with Independence Health and Therapy. I am one of the community support specialists and also the intake coordinator over all of our behavioral health department. So I'm here just to briefly talk about what community support looks like within our agency and how you can incorporate it within your care team. So community support encompasses a lot of different areas that we can improve your living, improve independent living skills, just a different array of skills that you can build on. So community support can be used for yourself as a caregiver or for the individual that you are caring for. So some things that we normally work on and can work on in community support is housing, being able to educate on the housing that is out there, getting you on some housing wait lists, or being able to help call around to housing agencies that may be able to provide some more information. Another big one, as Nancy had mentioned, is it's so important to have insurance. So it can be very difficult navigating online the different Medicare versus Medicare, or Medicare versus Medicaid, and being able to understand what you're eligible for and what each of them means. So we are able to guide you and encourage you to set up either in-person appointment with the social services, or being able to go to another agency that can get you some more information or referrals. We can also go online and help you with an application for Medicare, Medicaid, or other benefits that you may be eligible for. We also empower and advocate for you to advocate to yourself. So it can be very difficult to be able to call for a doctor's appointment, call for even setting up that initial appointment of counseling or psychiatry or another provider. So we really encourage you to be able to do the best you can, writing a dialogue, being able to role play with one of our community support specialists, and just help us be able to encourage you down the line, being able to call and make those appointments. We also help with computer literacy skills, so being able to help you learn how to use a computer, how to use your phone, navigate the web. In this world of technology, it's really important to be able to know how to go on the web, go on the internet, use some technology such as Zoom, and be able just to learn how to navigate those different websites. Another really important goal that we try to address is independent living skills. So that could be cooking, cleaning, money management, being able just to find transportation. And what's really important is being able to find referrals and resources for specific areas that we may not be able to address, and just be able to provide you with those referrals. So the next step, if you are interested in community support or just want some more information, is calling our main line or the intake line that will be provided to you. And you can get a hold of either our receptionist or myself and be able to get some more information. We'll do a brief screening to talk about a little bit more of the things you're wanting to work on, and then we'll be able to set up an appointment with you. Thank you.
Thank you all for attending our first caregiver course session. Our next one will be on the third Thursday of May from 5:30 to 7, and we look forward to seeing you there. You can register online at our website on that QR code on the flyer, or you can call into our reception desks. We look forward to seeing you and have a good day.